Hello, hi, this is Dr. Dennis Latuno again from Los Angeles, California. Today I'll be discussing about congestive heart failure. But again, disclaimer alert, my topic is not going to be comprehensive. I will only deal with the common signs, symptoms, and treatment. And also again, if you have any concern about your health, you need to see your primary care doctor if you have any questions. But also you can message me if you have any questions, and I'll try to do my best to answer your question. Also, second part of this blog, I'm gonna try to translate the presentation in Tagalog since most of my subscribers are Filipinos. But it's going to be hard because some of the medical terms are usually hard to translate in Tagalog. Anyway, we'll start. Congestive heart failure or heart failure itself. Symptoms are usually you get short of breath, you get tired easily, and your exercise tolerance is decreased, and eventually you develop swelling of the legs called edema. Sometimes you can develop irregular heart rhythm, and in the late stages of heart failure, you develop, you're not able to tolerate laying flat on the bed. You have to use 2 to 3 pillows to sleep. Causes of heart failure are usually coronary artery disease, meaning if you have a heart attack, it can weaken the muscle of the heart, resulting in heart failure. And then number 2 is cardiomyopathy, means weakening of the muscle. It can be hereditary, meaning it runs in the family. And number 3, uncontrolled hypertension. Prolonged hypertension that's not properly controlled can lead to heart failure. And then there's a viral infection called myocarditis, can also lead to heart failure. And if it is you have a prolonged or sustained irregular heartbeat, it also can lead to heart failure. And then if you have heart valve problems like aortic stenosis, meaning tightening of the aortic valve, this can lead to a left-sided heart failure. And also severe mitral regurgitation, the same thing happen. It can lead to left-sided heart failure. Okay, initial test usually to diagnose is, from the symptoms, clinical presentation, and confirmed by 2D echo. 2D echo is like ultrasound of the heart, where you able to determine the heart function, especially the ejection fraction. Ejection fraction is the amount of blood pumped by the heart into the circulation. It's calculated by a special formula, but 2D echo can tell you the ejection fraction. Normal ejection fraction is usually greater than 50%. And the next test is chest X-ray. Sometimes chest X-ray will show like pulmonary edema, which is fluid in the lungs. And then also a blood test called BNP, beta natriuretic peptide. If it is elevated, it can tell you that you have heart failure, but this is not a very specific test. There are criteria or classification of heart failure. First one is systolic congestive heart failure, and number 2, diastolic heart failure. For systolic heart failure, the ejection fraction is usually less than 40%. And then there's another criteria for heart failure called heart failure with preserved ejection fraction, heart failure with impaired heart failure, and heart failure with reduced heart failure. Reduced heart failure, of course, less than 40. With preserved ejection fraction is greater than 40%. Treatment-wise, we usually start with ACE inhibitor plus diuretics. I told you earlier in my presentation in hypertension, ACE inhibitor are the lisinopril, benazepril, posonipril, and diuretics are Lasix and Bumix. But if you're allergic to Lasix or if you have severe reaction from it, you can change it to ARB, which are the Cosar and Valsaltran. And you add actually a beta blocker on top of this, usually metoprolol-succinate or Coreg. So those three combinations, the initial treatment for heart failure. But right now, you can also start with a new medicine called neprilysin inhibitor, which is Entresto. You take it twice a day, but you start at a low dose, and then you slowly bump it up to the max dose as tolerated. But once you start neprilysin inhibitor, you have to discontinue the ACE inhibitor and continue with the beta blockers. The goal of treatment is to improve the quality of life and functional status of the patient, and of course, reduce hospitalization. Okay, that's it. And now I'm gonna have to try to translate in Tagalog. Congestive heart failure or sakit sa puso na ang mga simptoma nito ay hinihingal palagi, madaling mapagod, kakaroon ng mga palpitation, at pagka gumagrabe na, namamanas yung paa, tinatawag na edema, at yung mga late stage, hindi ka makatulog ng flat, kailangan mo ng 2 o 3 pilo para makatulog, para hindi ka mahirapan huminga. Ang mga causes ng heart failure, usually pagka nagkaroon ka ng heart attack, it can affect the muscle ng heart, so nangihina, can cause the heart failure. Pangalawa, yung tinatawag naming cardiomyopathy, ito yung either it runs in the family or may talagang sakit sa muscle yung puso mo na manghihina eventually. Usually nangyari ito sa mga bata pa. At pangatlo yung blood pressure, pag di mo kinontrol matagal, can cause heart failure din. At may viral infection na tinatawag na myocarditis, can also pwedeng mag-cause ng heart failure. At pagka matagal nang meron kang palpitasyon or irregular na heartbeat, it also lead to heart failure. Tapos pagka na-echo ka at nalaman meron kang problema sa mga valvula mo sa puso at tinatawag na aortic stenosis or mitral regurgitation, can also cause heart failure. Ang initial test na ginagamit namin is echocardiogram, usually para malaman yung ejection fraction mo, kung normal ba or mababa. Pagka below 40%, siguradong may heart failure ka na. Pero ang mga tinatawag na diastolic heart failure, usually normal ang ejection fraction mo, pero meron ka ring symptom ng heart failure. Ang gamot dito, usually ni-start namin sa ACE inhibitor in kombinasyon sa diuretics. So, mag-start ka ng mga lisinopril, benazepril, posonipril, with the diuretic, yung Lasix, tsaka Bumix. On top of that, i-add mo yung metoprolol, yung mga beta blocker or Coreg. Pero kung meron kang severe allergic reaction sa ACE, pwedeng palitan to ng ARB, kagaya ng Cosar or Valsaltran. Pero may bago ring gamot na ginagamit namin, yung neprilysin inhibitor na tinatawag, and ang trade name is Entresto. Pwede ring mag-start dito ang gamot mo, and pwede rin pero mag-start ka ng low dose, tapos bump up to the max dose twice a day. Pero once nag-start ka nito, you have to stop either the ARB or meaning ACE inhibitor kasi itong kombinasyon to ng sacubitril tsaka valsartan. At other alternatives treatment is pagka hindi mo matolerate ito, gamot na to, pwede ring combination ng hydralazine plus long-acting nitrates kagaya ng Imdor or Isordil. Goal ng paggagamot sa heart failure para guminhawa ang pakiramdam mo at ma-reduce ang pagbabalik sa hospital. Alright, tapos na. I hope you like my blog and you learn from it. Again, disclaimer alert. My topic is not going to be comprehensive and I'm not going to be to discuss everything. And if you have any symptoms of congestive heart failure, you need to see your doctor right away and be treated. All right. Goodbye and see you later. Again, subscribe and like to my channel, Dr. Dennis Latuno or Dennis Latuno. Okay, bye. Peace out.